The best way I'll tell you, whenever suppose usually elderlies get fall due to slip over the floor, or while walking on the road they get tumbled over some obstacle. Okay, so if it is an extremity injury, okay, most common what happens at home when they fall in bathroom or a wet floor, they get hip fractures. Okay, so obviously patient won't be able to move, or he may able to move, but there will be significant pain and deformity. So it is very easy for to understand a extremity fracture. So it might be lower extremity or upper extremity. Obviously, you can see some deformity, severe pain. My main concern occurs very rarely. What happens in hip fracture, there can be impaction of the bone. So because these bones are very porous bones, okay, they are not like normal young individuals hard bone, because calcium is low. They have osteoporosis. So one part of bone will get impacted inside another, and he may not get that severe pain. So if it is there is an injury, it's always recommended that get an X-ray done and rule out whether there is fracture, because of some pain threshold also in elderly. So if they are diabetic, there will be neuropathies. They may not get that severe pain. And hip fractures, if it is impacted, so then they may be able to move. They may even be able to walk also with minimal pain. But always get an X-ray. Main concern occurs when there is a head injury. So patient might be conscious. He may come walking to the department, but if at all there is a history of head injury, especially if they are on blood thinners, so they have some bypass done, some angioplasty done, or past history of stroke, they might be on ecosprin, clopidogrel, or some kind of blood thinners. So in these patients, what happens? There can be slow bleeding inside the brain. Okay, as you grow older, the brain shrinkens. Okay, and the skull remains intact. So there is a significant space in between brain and skull. Whereas in young age, there is no space, very minimal. So even a little amount of bleeding can give symptoms of a head injury, like vomiting, altered sensorium, all those things, and you can recognize it early. But in elderly, what happens? The brain, that bleeding will keep on occurring. There is enough space, so that compression over brain will take significant time. It may take 24 to 48 hours certain time, and you may not realize. So it is always, it makes a sense that any patient, elderly person who had a history of fall at home, even if they are conscious oriented, but there is an head injury, better to go to hospital, evaluate, and get a CT scan done. 99% of the time, getting a CT scan done will be helpful, because then we'll recognize this bleed early rather than late.
Right.